Yeah, I know. So
okay.
how I see
Hi
Anna, though.
there.
Wait.
Hi there. We're broadcasting live from our office today. We have a great guest with us. This is Betty, and she's our model for today. We're doing a Sculptra demo, and I'm going to tell you a little bit about Sculptra before we begin, so you guys know about the product. It's not something that people use a lot, but I love this product, and so I want to share it with you out there. Sculptra is a product that you can term a liquid facelift. When it's done appropriately, it can shave years off your face without the surgical downtime. And it's done in probably about 10-15 minutes, and you're out the door. You can have a little bruising from the injection, just like any injectable filler. And the results take about 4 to 6 weeks to show. That's why it's a gradual process, very natural looking, versus fillers where all of a sudden you just blow up the face and it looks like somebody had all this volume all over a short period of time. Instead, the filler's injected slowly. It may take 2 to 3 visits to get the complete injection. We may do a vial or 2 at a time, and then you come back at 6 weeks. We repeat the injection, and then you'll see those results gradually over those few weeks until you get to your next injection. So we may spread this out over 3 injections, which takes about 3 months to get to the full effect. But once that injection is complete, you should see those results last you at least 2 years. Now, the studies that were done by the company that came out many years ago, 10 years ago, the results, 88% of patients were happy at 2 years or 25 months. So that's saying a lot about this filler. It's very natural, and this is one of the reasons why I like it. I do a lot of fat grafting to the face, which is using your natural fat as a filler. And Sculptra, I would say, is very comparable to using your own fat in that it's a natural appearance and it lasts a good long time. So for those patients who I find I cannot get enough fat, this is a great alternative to use, and it's basically the filler material goes away with time, and what it does is it stimulates your own collagen, so it's your natural collagen that is being used as a filler material. All right, so we're going to get started. I'm going to introduce to you Betty. She's our model today, and I'm going to kind of point out some areas that I find are aging in her. Before we get started, though, I'm going to ask you, just so for the audience out there, they want to know probably, what's your age?
68.
Now, does she look 68 to you guys?
No way.
So I do start finding the areas that age as we get older are in the cheeks. So she's starting to get deflated here in the cheeks, more so on this left side than the right, and that's very typical. We get a lot of sun damage on our left side. Usually the left side shows more aging than the right. So she's got some loss right here and some here in the cheeks. She's also starting to notice some early jowling right here. Even for 68, though, that looks pretty good. Some folds in the nasolabial folds, and she's got a weak chin in the aging process. But Sculptra can be used in the chin too to stimulate collagen, and because of that, she's got this, what we call the marionette lines, just showing a little bit. So today I'm going to show you an injection with the Sculptra in one area. I'm going to focus on the cheeks here and do a little bit in the jowl area. The material is mixed with water, and so with the water, most of the injection is water. So you're going to get a lot of volume right away, and expect that volume goes down by the next day. So in 24 hours, most of that filler is gone. You're like, well, what was injected? Well, it's actually a process that goes over weeks. So the patient then goes home, and we'll ask Betty to go home and start massaging for 5 minutes, 5 times a day for 5 days. So remember that, that's pretty easy, 5, 5, 5. So can you remember that?
5 minutes, 5 times a day.
For 5 days. Okay, so you're going to be massaging in these areas, and that's stimulating the collagen. So it's important to do that for this filler. It's not like the other fillers where you just get injected and just go home. So but is a long-lasting filler, and that's why I like it. Okay, so before we begin, I'm just gonna mark out the areas that I like to inject. We have 1 vial today, so I don't want to spread it out too much over too many areas, because then you're not gonna see the effect of the filler. So the area that I'm gonna focus on today for her is the cheek and the chin marionette area, okay? I'm not going to do too much on the right side because she doesn't need as much, so we're going to focus on the left side. And I'm going to point out, this is the natural tear trough. She has a little bit of a tear trough there. This is what we call the malar septum, and so she's just showing that, and that makes it distinct from the cheek area. So here's the area that I like to inject, and this area right here. So this is one area, this is a second area. And then here is her marionette line that she's got, marionette fold. So I'd like to inject in this region right here, and then down here, because this area loses volume as we age. We lose volume in our jaw bone. So I'm going to put some more volume in this area with the Sculptra. Okay. Use a pen. Okay, and then here's her natural tear trough here. I'm using a Sharpie pen. I know you guys are like, oh my God, will that come out? It will. In Asians' cheeks, we have very good cheekbone structure, very nice high cheekbones, but where we lose volume is actually in this midface, this anterior midface. So I will do a little bit there, but we don't want to go too high. This filler cannot be used near the eye. So that's one contraindication. So here for her as well, and then down here, okay? Okay, so we're gonna get started. This material, if you take a look at it closely, okay, it's looks kind of white and cloudy, okay, but it's mostly water. So this material, I have to make sure that mixes well, because we don't want to get any nodules, and so I just want to get it evenly in there. But it looks cloudy in there. And then the other thing I will probably tap out is some of the bubbles. We'll show you pictures in about 6 weeks, some before and afters we'll add to the video so you can see all that. And then before we get started, I would like to just remove, you have some makeup on? Yeah, okay. So I am going to use a soap to kind of cleanse the skin a little bit. It will take a little of the markings out, not a lot, but I do want to just clean the skin a little bit. You may have to remark a little bit there, just because you are going to see some of that gone. Now, okay, just going to remark in this. Yeah. Make sure that it's dry. Probably get a little bit thicker even. Here's your lateral cheek. This is the submalar area, and your midface here. And marionette. Okay. All right. That will come off. It comes off very easily. I know you guys are worried about her probably. So I'm coming over here, and I'm going to go ahead and do my first poke. This is mixed with some lidocaine for you guys out there, so you know that this is comfortable after that first initial poke. Okay. All right. Here we go. Here's the first poke. So as you can see, mostly volume is going in there. And I'm just raising that submalar area of her cheek where she was weak. We're going to add a little bit here to the anterior midface. You already see the volume going in, but you're thinking, oh, okay, that's how she's going to look. Not quite. So this is something, as I said, that has to be done over a couple of weeks, where she's going to come in for another injection several weeks from now. Okay, how was that? Any pain? No, she's a great patient. Okay, now we're going to do our next syringe. I'm going to do a little bit more into this cheek. All right. You guys close enough? Can you see what's being done? Okay. Here, I'm just putting my finger on here just to kind of protect and make sure that I'm not so close to her eye. Because again, as I said, this filler should not be used close to the eye, but we can use it in the cheeks. Okay. And then that's all that I'm doing today in this cheek. I know that that looks like she has a lot of volume, and that's more than what she's going to end up with, actually, because a lot of this is going to go down since it's water. Okay. Now I'm going to add some structure here as well in this mid face. Okay. And that's it on this side. That was merely just to add a little volume in this anterior midface where she's getting a little weak. Okay. And last syringe, I'm focusing down here in the lower part of the face. This is what we call the marionette folds. Here's a poke. Okay, that's one side. We're going to do the other side here. I'm going to come over just so I can get the angle. Okay. And that is it. Okay. So immediately you do see quite a bit of volume. I did take my time to add more on the left side than what is probably going to stay. So she does look a little lopsided. That's okay. This goes away probably within the next couple hours. So that's, I'm going to wipe away the markings so we can take a look at all that again one more time. So the Sharpie pen works really well, does not stay. And I use this for my fat injections too, so that the markings can come off instead of a surgical marker, because we do have issues with surgical markers staying and leaving a visible mark that stays for a couple days. So, all right. And there you have it. So that was the injection, a little bit of volume in the whole face, but most of this will be water in. Part of this will stay. She'll come back in a couple weeks. We'll take a look and we'll do another injection to add more volume. All right. Thank you very much for tuning in, and I'll see you on Thursday for a preview of our next topic. Okay. See you then.
Thank you.
Bye-bye.
Bye.